Hello, my name is Madison Bunn, and this is a presentation to demonstrate the potential for process improvement around checking in a new patient in a doctor's office. Working on this project is myself, Ashlyn Cox, Taylor Ussery, and Jake Ryan for MBA Class 516, Section 808. In an article written by Jamie Dutcherme states that by compiling data from several sources, including the American Time Use Survey, researchers calculated that the average appointment takes 121 minutes. These 121 minutes include time allocated for the appointment itself, travel time, waiting, paying, and completing paperwork. In a 2017 annual Vitals Wait Time report, 700 patient respondents weighed in on how they felt about lengthy wait times. 84% of those respondents stated that a reasonable wait time was somewhat or very important to a quality patient experience. 30% of respondents said that they had left appointments because their wait time became too burdensome. In our process described today, we will focus on ways to decrease the time patients have to spend in the waiting room by streamlining the intake process, which includes paying, completing paperwork, and cutting staff entry time. Although patient wait times will vary across geographical locations, specialties, and patient ages, we have based our study on the idea that 80% of the 121 minutes is spent in the office completing intake forms, ancillary tasks such as paying and waiting. This percentage is based on a study completed by the American Journal of Managed Care, who concluded through various research that more than 80% of the time associated with visits was in activities other than face-to-face care with a physician. As a new patient, the various tasks that you may experience in a standard check-in process are signing in and waiting to be called back to begin check-in, providing insurance card, completing intake forms, and signing policies, making a payment, and waiting to see the provider. During the waiting period, after returning forms to the front desk, time is then spent by staff to input the patient information into the system, which includes all of the demographic and clinical information written on the paper and possibly scanning the documents into the practice management or electronic healthcare systems. Providers are unable to prep for the patient's appointment until this information is in the system. We have outlined this process and allocated time for each step to first evaluate how long it will take a new patient to complete the full process. Here you will see our current process map. The new patient arrives at the office. The patient signs in at the front desk to indicate arrival, taking approximately 1 minute. Patient then has a seat in the waiting area for 3 to 5 minutes. Patient is called to the front desk to begin check-in, taking approximately 2 to 3 minutes depending on the questions. Patient is given the paperwork and asked to provide insurance card. If the patient does not have insurance, the staff adds a self-pay charge. If there is insurance, the staff scans cards and manually checks benefits, taking approximately 3 to 4 minutes. Patient has a seat in the waiting room to complete paperwork, taking 8 to 12 minutes, and then the patient returns completed paperwork to front desk. The staff then requests payment from the patient, taking approximately 2 to 4 minutes. The staff manually enters all data into PM system, taking 8 to 12 minutes, and the patient has a seat in the waiting room waiting to be called back for 5 to 10 minutes. Then the patient is finally called back by the MA. Based on the various times allocated for each step, this process could take anywhere from 32 to 51 minutes, including wait time. That being said, there are numerous steps in this process that we believe, with the right resources, could be streamlined significantly to reduce this time. Due to the amount of time this process currently takes, we explored options to streamline the process, specifically implementing technology to hopefully shorten the wait time. We evaluated a product called Phreesia, which specializes in patient intake management. The idea of their product is to digitize the check-in process for the patients and the staff. This is done by creating electronic questions and forms that mimic what the practice needs to collect from the patient. Once created, the system can reach out to patients days in advance of their appointment to begin their check-in process at their own convenience. Once they complete the online check-in, even if they are at home days before their appointment, the system will integrate all of their answers to the questions and sign policies discreetly into the practice management and electronic health record systems. This cuts out paper forms and manual entry needed by staff. Once the patient information exists in the system, Phreesia remembers the answers to all questions and policies. Therefore, the patient is not being asked to complete the same questions again that they were at a previous visit. This will reduce the time spent filling out paperwork. With the Phreesia system installed, we have created a new improved process that reflects the necessary steps to complete a check-in. Here you will see our improved process map. A new patient arrives at the office. If the patient is pre-registered, the patient signs in at the front desk, taking approximately 1 minute. If no payment is due, staff acknowledges patient's arrival to notify the MAs for less than 1 minute. Patient has a seat in the waiting room for 3 to 5 minutes, and then patient is called back by the MA. If the patient committed to pay in office, the front desk staff collects cash or check payment, taking approximately 2 to 4 minutes, then informs the MAs of their arrival. Patient then has a seat in the waiting room, taking approximately 3 to 5 minutes, and the patient is called back by the MA. It is estimated that this new pre-registered process will take 7 to 10 minutes. In this new process, the patient no longer has to sit in the waiting room and fill out paperwork, return the paperwork to staff, and the staff no longer have to manually enter them. If the patient chose not to pre-register prior to their appointment, the patient will arrive at the office and sign in at the front desk, taking approximately 1 minute. Staff then sends patients electronic forms via phone or pad, taking 1 to 2 minutes. Patient has a seat in the waiting room to complete intake forms, taking 5 to 8 minutes. If a pad session, the patient returns the pad to the front desk for less than 1 minute, and if paying by cash or check, payment is collected, taking 2 to 4 minutes. Patient will then have a seat in the waiting room for 3 to 5 minutes until they are called back by the MA. With this non-pre-registered process, the staff no longer has to do any manual entries, and the patient will be registered for future visits. Once they are registered, they will no longer have to go through this process and will be allocated to the 7 to 10 minute process. In the initial process, costs included paper, ink, a printer, insurance, scanner, and FTEs to input the information. With Phreesia installed, this will cut the cost of all of these. With the new process, it is determined that just the software is needed, and if the process is streamlined, providers are able to see more patients in less time, resulting in increased revenue. To invest in a product to improve a process, the return on investment would need to be apparent, and we believe that with the reduction of physical costs, backfill of FTEs, and increased patient volume, the process could be beneficial to most provider practices. Here you will see our references.